Hello guys, and welcome back to my video. Today's topic will be about chemotherapy. And before I begin the actual chemotherapy facts and the different treatments of chemotherapy that are available, I'll be talking about my mom's story first. And a little disclaimer for this video, I am basing most of my chemotherapy facts and all these lists based off of what my mom experienced, what the Mayo Clinic did with my mom, and then the NCI protocol that most of the doctors follow to make their own little choices. So let's begin this video. My mom got her chemotherapy treatment after she did her surgery, and she got the TC treatment, or also known as the Taxol and cyclophosphamide treatment. Before she went into chemo, she actually cut off her longish hair to only have about a very short amount of hair in her head. And I would actually like to really thank the person who told us to cut my mom's hair before she went into chemo, because even after she cut it and then she did the chemotherapy and the hair fell off, she had a hard time dealing with it, even though she didn't even care for her looks actually back then. But it was still a very hard time for my mom, especially when the hair fell off. But I think it actually helped her to notice that only a short amount of hair fell off instead of a long amount of hair falling off. And so she went into chemotherapy, and she did it 4 times because she was an early stage breast cancer patient, and to be more specific, she was a stage 2A breast cancer patient. And after each successive treatments, there would be more side effects, and some would get more severe throughout her treatment. And for instance, she lost her hair not only on her head, but like her eyebrows, eyelashes, the nose hairs, armpit hair, leg hair, and hair just anywhere on the body. She lost all of it. And then there was muscle pains, and then there was also nausea, and then she had a little bit of diarrhea, and then she also got very sensitive to certain smells, and then she had a fever, and yeah, she had a lot of side effects. But I just want to tell you guys that these side effects and how severe it may appear on the person is dependent on how well the patient's body, I guess, responds to it. So each patient could have a different side effect that appears on them. And in my mom's case, my mom actually got these immune strengthening shots before her chemo. So she tells me now that her muscle pain, she doesn't know if it's actually a side effect of chemo or whether it was a side effect from the shot. But all I know is that she did have the muscle pains, and it was hard to watch her struggle with a lot of the daily things that she could do normally. And a little precaution, I guess, is when my mom actually got the cyclophosphamide injected into her body for the chemotherapy treatment through the IV, she actually got a shock to the heart because it was, I don't know, probably because it was the drug that was like newly entering her body. But thankfully, my mom was able to recover quickly because the nurses at Mayo were quick with these situations and was able to help my mom in no time. But the patient that does cyclophosphamide may go through these heart shock in the beginning, and then she also stated that she felt like she was thrown into the water, and the water unexpectedly like ran up her nose when the cyclophosphamide was added. So it may be a little uncomfortable when the cyclophosphamide is added. And the doctors and nurses recommend to the families of the patients during this time to not wear anything with a strong like aroma or fragrance into the place where they do chemotherapy, because the patients may react to it very badly because they're, as I mentioned before, sensitive to smell. So yeah. And I just feel like I know that some of you guys watching these, like some patients may be entering chemo, others may be just finished with chemo, while the others may still be in chemo. But I think the most important part that I learned through my mom going through the chemotherapy treatment is to never pity them openly, and to never like just be sad whenever they're around, because I know that they're already sad about the whole situation, especially when the side effects become very apparent. But even if the surrounding family members show like sadness whenever the patients show up, I feel like the patient, like my mom, had a very hard time when I did that. So later, but when I just went to exercise with her, watched like funny TV shows, and got her mind off of the side effects, the chemotherapy, and all the horrible things that were happening, she actually was doing a lot better than before. And I just realized that you have to accept the fact that they have these side effects and that it's very heartbreaking to watch, but get the patient's mind off of only these side effects and the chemotherapy, and get it on something that they can enjoy and relax to, so that they'll be more happy and they won't feel as much pain in going through these chemotherapy treatments. So next I'll be talking about the two main different types of chemotherapy treatments available, and the different side effects, and a little extra facts about chemotherapy. So the two main types of chemotherapy that are currently available are AC and TC. AC stands for adriamycin and cyclophosphamide, while TC stands for Taxol and cyclophosphamide. And while these two are different chemotherapy regimens, they have very similar side effects, and I have mentioned each of their side effects here. And they have very similar side effects, such as hair loss, nausea, muscle pain, diarrhea, and etc. And I just want to tell you guys again that no matter what side effect is apparent for the patient, please don't let them be scared, let down, sad, and worried about these side effects. Please divert their attention to something more happy and hopeful during this time. So, because the chemotherapy is a killing agent for the cancer cells, it also kills like some of the other cells in your body. And to be more specific, the chemotherapy pretty much targets the cells that have fast proliferation or division, and they pretty much target that and kill it. So that is one of the reasons why the hair falls off, because it divides really fast, so that it grows out once you cut it quicker and all that. So it's just it just does kill a lot of it, but please don't look at this in a bad way, and just think about how the cancer cells are dying, and that in all good luck that your patient will never ever have to deal with cancer again. And then most importantly, this is kind of regarding the diet of the patients. So when doing chemotherapy, some patients may actually gain weight while others may lose weight. And this is all again dependent on the patient. But during chemotherapy, protein is very important for the breast cancer patients. And I have listed a whole bunch of foods that are highly related for the proteins for the body. So please give this to your mom and whoever has the breast cancer and is going through chemotherapy. And finally, I want to mention that while a cancer patient is going through chemo, or just during like their cancer like journey in general, they have to really watch out for the different types of food that they eat. So they aren't allowed to usually eat like sugary foods, such as like most of the desserts that are available, such as cake. So I really hope that you guys will watch what you guys eat as well, because the patient, if they especially enjoyed eating like these sweets or other foods, they may want to eat it. They may want to eat it when you are eating the certain food that they're not allowed to have anymore. So please just be careful of what you eat around the cancer patient as well, because it's a hard time for them and you don't want to make it harder by doing something that could have been avoided, such as eating these unhealthy foods that you possibly like. So thank you guys for watching today's video. And through today's video, I hope you guys learned something about chemotherapy, what to expect during chemo, and most importantly, what to do for the patients during the chemotherapy. So, see you during the next video, and I hope you guys have a good day today. Goodbye.